my clinic, I have 4 iTeros. I have one Element 1, and I have 2 Element 2s, and I actually have the 5D as well. Well, honestly, a couple of reasons. When I built my new practice, which was about 5 years ago, I wanted the accessibility and the digital workflows in my clinic to be very easy. And sometimes when you only have one of something, it just tends to be a little tougher, and patients, your team, they won't just grab it if it's not with them. So I like each team member to have, an iTero scanner, an internal camera, and accessibility to these things, so that it just makes it easier. But once I saw what we could do with the iTero outside of, just taking impressions, there's just so much more you can do with it than that. There are, and it's easy to find, but if you haven't used iTero tools, the iTero tools is as big or bigger an asset for having the scanner than is actually the fact that my impressions are comfortable and easy, and all that. That goes without saying. iTero scanners have been around a while now, but it's those tools that I feel sets iTero apart, and my team is trained in using those tools to educate our patients and create a more greater picture. So seeing is believing, I like to say, and I really feel that when our patients see and understand things like their bite, it takes dentists years to understand occlusion, but we can teach with the iTero scanner, we can teach, and the tools, we can teach our patients about a good bite or bad bite very quickly. Like, they get it because there's images there, and it's very quick. It's not taking my team a lot of extra time to do this. And there's so many ways I talk about it, but it's been pretty easy to implement because I have a team that is really excited about using the technology, and they really are finding it easy to access those tools and then see the patient reactions. And when the patients more and more get to be inspired by what they're seeing, and they've never seen anything like it before, they are seeing the results. So it just snowballs. I'm from Canada, so we talk about snow. It snowballs into something like, it reinforces that this is a great thing. So our hygienists and our assistants everyone is trained to use the scanner, not just for impression techniques and Invisalign, which we do a lot of, but also for using those tools to educate. And then that just goes so much further. It sort of lays the foundation for our patients to help make good decisions about their oral health. I'm very occlusion based, so I did a lot of training in the last 10 years in occlusion, and I'm very focused in trying to improve the bite or the occlusion first. And so one of the big ones, and honestly there's 4 or 5, so it's really hard for me to pick, I'm going to tell you now, but we really use the occlusogram. So if you're not familiar with that, there's a lot of information out there. You can use it very readily, it's very quick, and it helps give the patient like it almost looks like a topographic map, or almost like if you're looking at a weather map with the red, and the red doesn't always mean bad, but it quickly tells the patient where red should be. And so we see a lot of red in the front, we can immediately say, correlate that with the fact that they're having chipping, where maybe they're having recession, and all those things then allow us to, again, track what's happening. However, what I also love is time-lapse. Sorry, one of my other favorites is time-lapse, because what we've been doing for the last 2 years, almost 2 years now, is taking a scan, digitalizing our patient, and then tracking, then digitalizing them annually. And now we can compare, we can actually show that, look, there's been a change. So if we didn't convince them on the first time round, look, that red is getting worse, that chipping's getting worse. Now the time-lapse is showing we don't have to be the bad guys. The scanner is really telling them the story. And so I let the scanner tell the story and let it just sort of be their understanding without us having to say a lot. And sometimes it's better when we stop talking, because we talk in terms that they don't understand. But the images really speak for themselves. It's amazing. Well, I think from a marketing standpoint, so I think of my scanner and I use it in my marketing as, we are a digitally based practice. I try to use it as far as talking about how we're different and providing more value for the patient. But it is my best internal marketing tool. So if we divide marketing into, you're good with marketing, external marketing, internal marketing. We're always talking about, we need to be on social media, we need to have a good website, all these things. However, if we don't have a great internal marketing game and we are not really encouraging, we're not reinforcing the stories that we're saying online inside the office, then when the patient arrives, they're maybe not experiencing what we promised online. So I think with the scanner is my best internal marketing tool. So interestingly, I did a little research into how much dentists should probably be spending on their marketing, based on their gross, income, or whatever. And you can really afford a new scanner per year if you really think of it. You don't need a great website, you need all that, but your scanner could almost be put into your marketing budget from if you want to think about it that way. And it's really one of those things that once the team's on board, it sells itself. Again, you let the scanner tell the story, tells a story about how awesome and cool your practice is, and also how your practice really stands behind what it's doing. And so that's pretty much it for me. My internal marketing tool is my iTero. Back in September, we had a patient come in. Now, our new patients all experienced it being digitalized. So part of that process is having an iTero scan. We tell you, we're going to digitalize you. I get this from Christian. And then we keep that. And it's part of, again, they would have annual scans. So he comes in, his mom, his brother had already been a patient there. And so they came in and he had that. Now in December, just before Christmas, so days before Christmas, his mom sends this picture of him. He had been in an accident. He's defending his friend and he was kicked in the mouth. So he had no front teeth now. It's days before Christmas. And my hygienist, I actually wasn't even in the office at the time. My hygienist says, you know what, maybe we have an iTero scan of him. Maybe we can duplicate his original teeth and get him something to wear over the holidays, right? So sure enough, had it, and within, we have a printer in our clinic, we have the Form Labs, and so we printed his model, his original teeth, had an Essex with teeth in it, his own teeth, his very own shaped teeth. Mom is over the moon. She never expected that. I didn't even realize that, but because my team is they're used to talking about the benefits. We talked about it behind the scenes. We're really excited about it. He thought of that, and so I was like, this is a cool story. So I think more and more there's a value to being able to making sure that you have a copy of, it's like anything, saving a copy of your most precious things, right? And our most precious thing is a smile. And having that in the iTero, in the cloud, to reproduce, which is what we're going to do. So he actually he's not this type of guy who he's taking this opportunity to get the perfect smile. He wants his original teeth. So we are going to get that for him, and the planning center is helping me do the guide for that.
Such a great story.
That's awesome. I was happy too. The power of how it can change your practice. Again, it's not just a tool to take better impressions, take easier, it's about the patient experience, but it's about these tools that allow the foundation. Probably more than 50% of what I do with it is educational and it sets yourself apart. So not everybody's willing to go out and buy a scanner, buy 2 or 3. But the more you embrace that, the more you can really, at this point in time in dentistry, really set yourself apart. Tell stories on your social media, on your website about what type of things you're doing, and also just tell the public what's available. And I think we owe that to the public, and it's really important that that people appreciate the iTero scanner for all the things we can do with it outside of just your traditional things that most scanners do.